So we are lucky that pharmacology evolved to cure many illnesses, but doping evolves together with pharmacology, and anti-doping must evolve too. So it is a continuous chasing between dopers and who follows the dopers and who has to detect the doping substances. The prohibited list, it is continuously changing due to the continuous emission in commerce of new drugs, new pharmaceutical drugs, and substances are included in the prohibited list if they have the potential to enhance the sport performance, or it may be a risk for the athlete's health, or it violates the spirit of sport, or it can alter or tamper anti-doping control. Every year there is a new list. And the list is divided into two sections. Substances that are always prohibited because they act if taken in continuous manner, and for example anabolic steroids or EPO, and substances that are prohibited only in competition. Between the substances prohibited always, there are the substances, the drugs, that are not approved for medical purposes. The drugs that are not on the regular market of drugs. Then we have anabolic steroids, a lot of anabolic steroids, and analogs, endogenous anabolic steroids, other anabolic agents, and new entities. Well, I worked in the anti-doping lab of Rome until 2011, and since the list has completely changed. There are a lot of many more substances to look for. For example, selective androgen modulators, erythropoietin and hypoxia-inducible factors, other agonists, all new substances. Other peptide hormones like chorionic gonadotropin growth hormone and analogs. Other growth factors, a lot of growth factors. Also substances that are generally used in therapy. Beta agonists, these are quite widespreadly used, also by young athletes. Salbutamol by spray in order to enhance breathing. It is not safe, absolutely. They are prohibited. Hormone and metabolic modulators. Diuretics that can help to mask the presence of other substances in the urine of athletes, or that can help losing weight if there is the necessity to be in a determined category. Prohibited methods, manipulation of blood components, mainly hemotransfusion, or every form of manipulation of the blood. Chemical and physical manipulation that is performed mainly to tamper and to alterate the urine in order not to detect substances, and gene doping. In gene doping, exogenous genetic sequences are inserted into specific tissues, and it alters the gene activity and alters the expression of a protein. What is gene doping? In gene therapy, there is the substitution of defective genes with new genes in order to treat some genetic disease or cancer. There are very few applications of genetic therapy. But there are a lot of proteins that could be decoded by our DNA that would have an enhancement in the sport performance if they are modified. For example, erythropoietin is the first protein. If we produce more EPO, we have a boosting of oxygen supply, and there is a delay of sense of fatigue. Or other proteins enhance the strength and the muscle mass. Or other factor augment the vascularization of our muscles, so a genetic modified VEX or FGF can increase blood perfusion in muscles, and it helps to postpone fatigue. And endorphin and enkephalin, our endogenous opioids, they help us not to feel pain. For example, when there is a lot of lactic acid, it could improve pain tolerance, and so on. Many possible protein can be the target for gene doping, but there is not at the moment the evidence that gene doping is already used by athletes.